A shocking announcement from the American Cancer Society today. Women should screen for breast cancer later and less often. The Now's McNamara asked the doctor what's behind the big change.
These new guidelines are not only shocking, some women say they're worrisome. It only makes sense. The earlier you check, the earlier you can detect breast cancer, right? Well, the American Cancer Society says not necessarily. Here's a look at the changes. Before today, women started getting mammograms at age 40. Now the recommendation is age 45. And previously, women would get routine manual breast exams from their doctors. Now the American Cancer Society says you can skip those.
But then on the other side, maybe you do find cancer earlier in these women, and it does make a difference for their survival. And the controversy is they do these big randomized studies for years with thousands of women, and the problem is some of the studies aren't done correctly. They're not done as well as they should.
We talked to one doctor who says he will still recommend mammograms start at age 40, and here's why.
You're right, it seems like a no-brainer. The sooner you find cancer, the better off that woman is going to be. And I think there's plenty of studies that show that. The issue is in these younger women, because of the nature of their breast tissues, it really making a difference or not. Very controversial.
Dr. Paul says one main reason the American Cancer Society is changing guidelines is stress. Oftentimes, doctors find a lump in younger women, do a biopsy, and it's a false positive. So this is partly to avoid costly, time-consuming, and sometimes painful tests that were for no reason. For the Now, I'm McNamara.